Arthritis is basically erosion of the cartilage, which leads to joint pain and stiffness. There's also rheumatoid arthritis, which involves the joint membrane, the lining around the knee. So what happens is this is an autoimmune response where our immune cells attack the lining of the knee, causing severe, painful inflammation in the knee and swelling.
We started talking about a little bit backstage, Dr. Raj, that it's, as you mentioned, it's a disease of the cartilage, right?
Absolutely.
And unfortunately, you only get one set of cartilage. The cartilage doesn't have a blood supply, so that over the year, or an injury, whether it be wear and tear over the years, as you wear that cartilage down, you can't regrow new cartilage. So that's what you're faced with as far as trying to improve somebody's joint that is worn out.
But you are saying now that there are some treatments that may help stabilize that cartilage. And tell us about that.
Well, there's a study out there now, from the UK that talked about stem cell injections into the knee. And essentially what it is we're taking umbilical cord blood, which are stem cells, mesenchymal cells, which are undifferentiated, and then harvesting these cells into a jelly-like substance. So once they're multiplied and the concentration significantly, we will inject this right into the area of damage. So with respect to arthritis, it's the knee where we have cartilage loss. And now this study in itself, which is amazing, showed a 67%, up to a 67% regrowth rate of cartilage.
Wow. Which is remarkable because normally once your cartilage is gone, it's gone. Do you think these injections of stem cells are going to be potentially effective in all joints, or are we talking more of the big joints like the knee? Because we all know rheumatoid arthritis can severely affect the joints, the smaller joints of the hand.
That's a great question, Travis. I mean, these injections in itself help all joints with osteoarthritis because it's the cartilage that's deficient. I mean, if it's a cartilage issue, it's cartilage regeneration. It's the same deal when we use it in a fracture that doesn't heal, bone regeneration. These are pluripotent cells that basically attach on and to an area of damage and start forming.
This gives you an option to try something else before you go down the path to joint replacement. And the more tools like that we have in our arsenal, the better. Dr. Rush, thank you for that explanation. Now, arthritis treatments aren't only available when you visit your orthopedic surgeon. In fact, one Colorado woman discovered a pain prescription involved eliminating a certain type of vegetable.
Came out of nowhere. We were moving to a new house, and I was packing, and I noticed the knuckles in my hands started to hurt. I mean, really hurt, and it didn't go away. The pain was like a deep toothache inside the knuckles of my hands. I had a friend, and she noticed my bright red inflamed hands. She said, "What have you done to your hands?" And I said, "Oh, I've got this arthritis problem. I've been going to doctors for the past 3 years and nothing is working." And she said very calmly, "Have you ever heard of nightshades?" Nightshade foods are tomatoes, peppers, white potatoes, and eggplant. I was really doubtful that giving up nightshades would help me, but in just a very few days, the pain was completely gone. I was inspired to write my book, Caroline's No Nightshade Kitchen Arthritis Diet, because I found that I was having a lot of fun working with recipes, converting them into something that is equally delicious, sometimes even better, without the nightshades.
So we actually have a little nightshade-free pizza. Now this pizza, it has feta cheese, mushrooms, it's on a whole wheat tortilla, spinach, olives, and I do like the concept that there are some people out there that react to certain types of foods that create inflammation in the body. We know this.
Absolutely.
You know, I'm starting to feel a little better already.
Oh, good.
I think the takeaway from this segment is that there are a lot of different options to try. Work together with your doctor to figure out what option may be best for you. Sometimes it's one option and try the next, and it's a process of elimination. And Dr. Raj, thank you so very much for helping us out. And if you want the recipe of Caroline's